Welcome to our series of healthcare scene interviews where we sit down with top leaders in healthcare IT. I'm John Lynn, the founder of healthcarescene.com, a network of leading healthcare IT resources. So check it out at healthcarescene.com. Before we begin, I wanted to remind those watching live that we'll talk for about 30 to 40 minutes, and then we'll open it up for questions from the audience. Also, a few housekeeping items. If you like what someone's saying, or maybe if you just like that person in general, you can click on their face and give them props. It's always fun to get those. Also, on the left side, there's an option where you can tweet it out and share this discussion with your followers. So if you do that, it's much appreciated. And finally, if you're watching live and you have any questions for the audience, you can do /Q space and then your question in the chat, and that will queue the questions up for us. And we'll do our best to incorporate those questions during our conversation. If they don't fit in with the flow of the conversation, we'll definitely take them in the after party in the second 30 minutes of our conversation. So enough with the logistics. Now for the fun. I want to welcome my two guests. Both from the Louisiana Healthcare Quality Forum. I'm used to healthcare being together, but I think I'm bad that way. Anyways, first we'll start off with Jamie Martin, Marketing and Communications Manager. Welcome, Jamie.
Thanks, John.
How about you tell us a little bit about yourself?
I am the Marketing and Communications Manager for the Quality Forum, as you mentioned. My primary goal is to work across the leadership within our organization, across initiatives to drive patient-facing, consumer-facing strategies related to health IT specifically and all initiatives in general. And parts of that, I do the social media platforms for the organization. And my current project, the GYM, is patient engagement for a statewide direct-to-consumer campaign.
Nice. And that's what we're going to learn today. And I think most people probably know you, but they know you as at LHCQF1 on Twitter because I think you are the face, correct?
Yes, that's me.
That's right. So, I mean, we've seen you in so many chats. I'm excited. Now we have a real face to put with the handles. So, welcome, Jamie. Also, we have Linda Morgan, Marketing and Communications Director for the Louisiana Healthcare Quality Forum. Welcome, Linda.
Thank you, John. About me, I'm the Marketing and Communications Director, as you've mentioned. My role is to plan, to implement, to maintain marketing and strategic communications plans for the organization as a whole. I'm also the person who is the keeper of our brand, our identity, our image, and work very closely with Jamie and the rest of our Marcom staff. My background has been primarily in the healthcare hospital side of marketing and communications, with a little short stint in health insurance, as well as nonprofit fundraising. So together, we both bring some interesting past experiences to the table, and we've both been doing this. I've been working with the forum since about 2010. So.
Interesting. Yeah, we may have to have you on another time to talk about the differences in all those three, right? The hospital, profit, interesting.
The dark side, the light side, and the I don't know what, but it's everything. Don't go there.
I think we all know. But for those who aren't familiar, how about you guys tell us a little bit about the Louisiana Healthcare Quality Forum? What's its goal? How did it come about?
I'll start it off, and Jamie, feel free to add in. But the Quality Forum was established in 2007, and it actually came about after Hurricanes Katrina and Rita hit the southeast and southwestern coastal areas of Louisiana. It's an understatement to say that it decimated the healthcare delivery system, but it did. I mean, it's true. And not only did we have to rebuild communities all across the southeast and southwest, but we really had a chance to rebuild our healthcare delivery system. And lo and behold, some very astute and wise legislators and state leaders and business people got together, came up with a wonderful recommendation. Part of it was the creation of the Louisiana Healthcare Quality Forum. We serve as a regional healthcare improvement collaborative, and that's a lot of words, but what we are is we are truly a neutral convener. We bring together some of the healthcare stakeholders, patients, providers, purchasers, and see, who am I missing? Patients, providers, purchasers, and insurance, the payers, and employers too. So we bring these people together. We talk about what's needed in healthcare. Part of our goal is to reshape healthcare and health for Louisiana residents. And Quality Forum was born. We have several main initiatives. One of our large ones, which leads into our topic today, is health information technology. But we also are very focused on patient-centered medical care and practice transformation, quality measurement and analytics, end-of-life care planning, as well as the topic which brings us here, I guess, also today is outreach and education.
Nice. Well, it looks like you have a pretty comprehensive portfolio, but what definitely intrigued me, and really I wanted to do this because I think you've done something interesting that a lot of other states might be interested in learning about, and that's really trying to push patient engagement in Louisiana. And I saw Jamie's session at HIMSS, and I knew that we needed to share this with a broader audience. So, as we start this discussion, ePatient Dave, the famous ePatient Dave, he asked us to start off by saying, how would you define what you consider patient engagement?
Okay, so first I just want to say having a question from ePatient Dave has completely made our day. We are complete fans. So
I'm a fangirl, ePatient Dave.
I took my first selfie with him last week or a week and a half ago. So, he's even better in person than you could imagine. Imagine him at South by Southwest on 6th Street with a bunch of drummers. He's incredible. Wow. But anyway, so we all agree.
I think we frightened him once. Lynn cornered him and got a selfie with him too. So, yeah.
I'm so sorry.
But, he likes me. Don't worry.
So for the question about how we define patient engagement, so for our purposes, we define it as patients taking that proactive role in their health, whether that's through electronic means or more traditional means, like just knowing how to ask questions of providers and what questions that they need to ask. I will say there has been a lot of debate and discussion about how to define patient engagement, and our definition may be a little on the simple side, but I have to say that it is a definition that supports our environment. So what I would say is that Louisiana is a state that's all too often at the wrong end of the healthcare ratings. We're among the worst in the country for outcomes, cost, quality, chronic disease, infant mortality, ED utilization, hospitalizations, and the list goes on and on. And so we know that to make meaningful and long-term improvements in those areas, we've got to have the patients engaged in their care, taking responsibility for those decisions, having and using those tools and resources to make better decisions about their health and health care. So if our definition is maybe a little different than all of those amazing patient engagement research experts who may see this later, I do apologize. But please understand that we came up with a definition because we needed a definition that supported our environment here in Louisiana. So that's how we're defining it for the purposes of this campaign.
Well, it's interesting. I mean, you just compared something practical that is actually happening to a bunch of researchers. And I think most people care about the practical, not the research. But I mean, is that why your organization is so focused on patient engagement? Is because you think that having the proactive patient is going to provide benefits to the healthcare system in Louisiana? Is that the goal?
Oh, Jamie, I'll let you start off.
Okay, so I'll say that since we were established, that patient engagement, well, let me step back a second. Since we were established, outreach and education was one of our critical initiatives. I mean, it was one of the first ones that we had when we were created. And I'll let Lynn talk just a little bit about that because she was here during that transition to taking that messaging from providers to patients. So do you want to jump in on that?
Like you said, outreach and education was one of our core initiatives. But before we got to that point, before we were ready to really start bringing this information to all of us, to you, to patients, to Jamie, to everyone who's on this interview here, to healthcare consumers, we knew that it was really important to educate the providers. We also serve health information technology is one of our large initiatives too. We served as the regional extension center for Louisiana. We've also we're the state designated entity for performing, developing, and administering now our health information exchange. So we worked very closely with providers to teach them about electronic health records, meaningful use, to teach them how the exchange will seamlessly integrate the information from source to source, from venue to venue. And if you've worked on the healthcare marketing side in hospitals, you kind of get to know too that you need to let your providers, you need to educate them, inform them, support them before you can really go to the patients. Because patients look to their healthcare providers for guidance, for information. And if that information isn't there, it really creates a void and puts the provider in a very precarious position. So what we were really doing for the last few years is working closely with providers, hospitals, health systems, clinics, to give them the tools that they needed with information to support it, so that we could take that campaign finally to the public. And it's kind of like the end game for us. It is that final phase. Everyone has been educated, informed along the way, and now it's ready for prime time.
That's a great insight. What was your pitch to doctors when you were saying, hey, you should have this information available to patients and you should start engaging patients? I mean, what benefits did you suggest to them, or what was your pitch to them to get them interested in engaging?
Well, you got to think back, John, and everyone here. A few years ago, meaningful use was introduced. So over the last few years, some meaningful use objectives and criteria have become entwined with electronic health records and incentives for physicians. Patient engagement is is a key criteria for that. And I think often I'll say this too, because I've worked in healthcare for many years now, as people are coming on board, new residents, new people entering the healthcare field. They're learning with electronic health records. They're learning about patient portals. They're learning as they're being educated, and so I think they're beginning to expect it as part of their training and part of their work. So I think it was kind of, I'll say this: it's not an easy sell. Because introducing electronic health records has not been easy, as you probably know from across the country. People have different stages of their careers. They have different scenarios. They're in different positions, so there are many reasons. But part of the criteria for meaningful use is active patient engagement.
So that's great. I mean, $36 billion of stimulus money should stimulate doctors to do something, right? So it makes sense that you ride the back of that money. So as you started to do it, I think that's great. You transitioned from let's educate doctors, and of course, I think it's an incredible insight is that we can't go and market to patients to start engaging if the doctors aren't ready to engage, or otherwise you just burn that whole relationship.
Exactly.
But now as you start to engage patients, what have you found? Why aren't patients engaged? Like why do we need a campaign to tell patients to start engaging? Like why don't they just do it themselves?
So one of the benefits of our organization is that we do have that regional extension center in HIE within our umbrella, or under our umbrella. And so what we know in working with those providers through the REC and through the HIE is that providers think that patients have no interest in engaging, and they don't think that patients like the tools or trust the tools or want to use the tools. And that's very unfortunate, because our consumer partners are telling us, and our pre-campaign survey data verifies, that patients do want to engage, but they're hesitant to do so. Now, some of that hesitancy is a result of fears about data being compromised, and concerns about how their information might be used. And of course, there's always that factor of the technology is maybe not very user-friendly, and maybe the technology does not give them access to data that they can use to take action, meaningful data, valuable data, and that's unfortunate. And the flip side of that coin is that in working with the REC and with the HIE, we're able to convey that messaging back and forth between the consumers and between the providers, to tell the providers, yes, your patients want this, and to tell the consumers, yes, your doctors are doing this, and they want to help you. Let us help you. Let us work with you. And so it's very much a two-way street. And so there is no, I think, singular answer to why patients aren't engaging. I think it's a multiple choice.
Yeah, I was going to say, you highlight a number of the ones I've heard, right? Security being one of the major ones. They don't trust their health data. I mean, the most intimate data that we have, I mean, literally intimate in many cases,
Right.
To be online. Also the usability factor. And Charisse commented in the live stream chat, she said, I wonder who's circulating that erroneous data. Patients are adopting engagement tools at a faster rate than providers statistically. I think there's a lot of denial maybe from doctors that, about what patients really want.
Yes, so that's very true. And I'll say this about the security issue. Now, my background is in journalism, so full disclosure, I am a reporter at heart still. So what I'll tell you is that those huge media stories about the compromised data, and they're scary. I want to be very careful because I'll get on my soapbox, and I don't want to do that. But they're terrifying patients, and it's understandable. It's terrifying to me too. But what's really unfortunate about it is that those patients are hearing these stories about laptops being left in taxi cabs and data being compromised, but they're not hearing those stories about all of the lives that are being saved because this data is available electronically and in real time. And I think that would be the better story. But unfortunately, blood and tears sells better than positive news, which is an unfortunate truth. So
yeah, and it's lazy journalism too, which I guess I'm somewhat a journalist as a blogger. It's easier to write the negative story. You have something to say, Linda?
Yeah, I was going to add, John. Just as a personal story to tag on here is the security issue. I mean, I am one of the targets of our campaign. I meet one of the target criteria that we've established I'm a baby boomer, but I'm an engaged patient. I'm an engaged patient because, in full disclosure, a couple of years ago, I was diagnosed with breast cancer. So it became very obvious to me how advantageous it would be to have a single source with all my information in it, with all the many doctors that I've had, at all the hospitals that I've been treated, with all the surgeries and treatment that I've received, to have one longitudinal or just one overall health record so that everyone could share it. And that's still in pieces right now. I'm not so much worried about the security of it. I'm all on board with that. I'm more worried about office people looking at my paper records in their offices. I think that's much more a probability of happening than a breach. But that's my goal, is to have an electronic health record with all the information about my treatment, my health care, in one place. Right now it's scattered and it's shattered between like 3 different hospitals in 4 different cities and with many different specialists and doctors. And I'm frustrated about it. I only have 2 portals, but I'm still frustrated about it. But I mean, I'm hopeful because I know this is just not going to happen overnight.
Yeah, there's so many good points there. I'm reminded someone recently asked the question, okay, we've had, a third of the patient records in the U.S. have been breached. If you look at the Anthem breach and some of these big, massive ones, right? Mm-hmm. Add them all together, a third of the health records have been breached. And how many have had a negative impact from that breach? So, it's like, okay, well, there are all these breaches. And I agree. I think we obviously need to mitigate those risks. But should we be afraid of it? Right, like it's happening, and has it impacted those third of Americans? What, the 100 million people? So I think we do need to dispel that myth, and highlight the stories like you described of people that can't get the right information to the right doctor, and their health is suffering because of it.
Right.
Which is the harder story to tell. Because no one wants to admit that that's what happened, right?
And, we were saying, I know something Jamie and I have talked about in the past, too, is not only is it some way to be overlooking if you're afraid about security breaches and so on, and I'm concerned about people in the office looking at things, but how many people share their information about their personal health history on Facebook or and so on? So, I mean,
talking on cell phones.
Right. So, there are different, some people may be breaching their own information just by what they choose to share.
They do for sure on social media.
Right.
But I think it was interesting too. You said that, you're kind of in that part of your target market is the baby boomer population, which I think also another myth is that the baby boomers don't want to engage with their health. They're not tech literate. What's been your findings there, and what's been your approach to engaging the baby boomer market?
Okay, so I'm so excited, John, because you have just given me an opening to tell my favorite story about this whole campaign.
Rob is all about stories, so you guys are perfect.
So when we launched the campaign, I said the exact same thing you just said. There is this idea that we'll say seniors in general, that seniors in general don't trust the technology, are not tech savvy, just don't want to use it, don't know how. And we went into this kind of with that thinking, and we were absolutely wrong. The very first patient who reached out to us when our campaign went live in August was a gentleman named Jim Downey, who is 76, I believe, and he's retired. He has 4 different providers. He has a primary care provider, he has an oncologist, a cardiologist, and a dietitian. And every one of those providers has a patient portal. And so when I knew Mr. Downey was on the phone and I knew how old he was, I just thought to myself, here we go. I'm going to get the lecture about how the technology is horrible and he just wants things to stay the way they are and so on and so forth. And I got on the phone and it could not have been further from that. This man loves his patient portal, loves it. And the reason that he reached out to us was not because he didn't know how to use the technology, doesn't trust it, he doesn't like it. It was the fact that he wants all of that information in one place with one logon where all of those providers can see it at the same time. That was his concern, and that's why he reached out to us. And I think that's very telling, and that's what we have found across the board for the most part. Now, I will tell you, too, on the flip side of that, I'll tell another story. When we first began building the foundation for this campaign, we did a health fair here in Baton Rouge. And Lynn, you may remember this story. We were providing information face-to-face with consumers about electronic health records and the HIE and patient portals. And an older lady who was just adorable, so cute, and just looked like she would bake me cookies and let me watch her after videos with her.
I thought it was Jumbo in Louisiana, but
she was very, very sweet. And so I start running through my spiel and I'm sharing this information with her, and she stopped me on a dime and she said, I know what you're doing. I said, excuse me? She said, I know what you're doing. You're taking my health information and you're giving it to Obama's death squad. And I'm standing there with my mouth hanging up because I'm really not 100% sure how to reply to that. And I tried to reason, and some people are set in their arguments, and she was not having any argument from me. She was absolutely certain that was what was happening until I reached the point where I finally said, I'm so sorry that you feel that way. Just please understand, I do not have your health information. It's not back here in my purse. But I do want you to know these tools are here should you decide to use them, and please take this information. And the point being, there are going to be segments of the population, and it's not age specific, who just will not use these tools and resources, and that's unfortunate. So as much as we want everyone to use it, the idea that we will get 100% engagement is probably not realistic, not here or anywhere else.
Yeah. Well, there's many people that fear all sorts of false fears. So I think that's the example, you're giving it to Obama's death squad, right? What a line, right? So certainly, it's not going to be 100%. But, I think the key is we can do better, that there's lots of opportunity here. And so, I want to kind of transition from kind of what are the benefits of patient engagement to kind of some of the specific things that you're doing in this campaign, this education outreach, because I think you're doing some non-traditional things. Everyone says, oh, well, okay, if we want to engage the patient, we should use social media because that's like the engagement platform of the century, right? I know you're going beyond that, right? So tell us, some of the things that you're doing in the campaign, to really spread this message.
Okay, so I have to tell you, the thing that we have done that I am the most proud of is establish a healthcare consumer advisory council. And this is composed of consumers. They are representatives of roughly 15 patient-facing and consumer-facing organizations across the state. And having that counsel at the table in discussing and developing and driving our strategy has been a tremendous asset. I mean, these people have incredible insight into what patients are looking for, what they want, what they need. And I would say to anyone who may be watching or tuning in later, if you don't have patients at the table in developing a patient engagement strategy, you're starting off on the wrong foot immediately.
Yeah. Patient Dave would be so proud. You just said that you went to a health fair and actually talked to patients, and you have a council of patients. So he'll be proud, I'm sure. Were you out?
So, but the council worked with us, and we did identify that Louisiana does have a few challenges. We are a rural state. 64% of our population lives in a rural and or medically underserved area, and it's very difficult to reach those populations through traditional marketing and communication measures. They're not necessarily picking up the statewide newspaper or listening to the big channels on the radio. And so we had to be unique and know our markets. And what we know is that in those rural areas, internet is not necessarily in the home, but it's on their cell phones. So everything that we do is mobile friendly. And of course, there is social media, because I think it's impossible to do anything now and not be on social media. And so we do have that paid and organic social media outreach. We did some unique things. We did some place-based advertising, for example, kiosk in malls to get that messaging out, because we know that those people are shopping in those malls. We have radio advertising that we're using. We are also doing some print advertising, but I will say this with a cautionary note. We've been very selective in how we've done that, because number one, we are a private not-for-profit and our budget is limited, unfortunately, because I would love to just have a huge budget to just buy tons and tons of television ads, but I don't. So that's made it a little more difficult. So in doing print, we decided to not invest much in print advertising in day-to-day newspapers. Those ads are very, very pricey, and I'm a newspaper journalist at heart, so my apologies to all you print people. But they are very pricey, and they only have a shelf life of about a day. So we focused our print dollars more on niche publications for parents, for seniors, those target audiences that we really wanted to reach with this messaging, that we felt could most benefit from this messaging. And so we put more dollars into those niche publications than we did traditional print. Lynn, am I missing anything? Lynn was in charge of our media buys, and she's done a tremendous job of bringing in that unique rural aspect.
It's a real challenge to do a media buy with a limited budget, and you're trying to reach the entire state. I have to say, it really is. It takes some planning and some strategy behind it. One of the other things that Jamie didn't mention is that we've also been very active in digital outdoor boards. In addition to mall advertising, is place-based. We've also done outdoor advertising, and we've
billboards that are digital. Is that?
Pardon me?
Is it digital billboards, or is it other?
Yeah, digital billboards, as opposed to the traditional. We have 7 key markets across the state of Louisiana. And so with some strategic buys as far as billboards, outdoor boards go, we placed boards that can be seen on interstate as well as street level. And just to be able to capture people who are in the cities as well as those who are traveling the interstates, because we're a very mobile society in Louisiana too. A lot of people are on the roads all the time. So we've done that in digital is much better, because we can change our messaging out as we want to, and we can keep it fresh with different messaging, all aimed toward the same target. But broadcast radio, outdoor boards, mall advertising, social media. I think and radio, we tried to do what we could to make the most of our funds and to reach as many people of our target audiences as possible.